It is now time to hear from a distinguished leader whose vision and commitment to development continue to contribute significantly to the progress of Telangana. It is my honor and privilege to welcome our chief guest, Shri Bhatti Vikramarka Mallu garu, Honorable Deputy CM, Government of Telangana, a respected statesman and public servant. Shri Bhatti Vikramarka Mallu garu has been at the forefront for driving initiatives that strengthen infrastructure, foster inclusive growth, and enhance the quality of life for citizens across the state. His leadership reflects a strong commitment to build a future-ready Telangana where innovation, accessibility, and sustainable development remain key priorities. Ladies and gentlemen, with a huge round of applause, I would request Bhatti Vikramarka garu, దయచేసి stage పైకి రావాల్సిందిగా కోరుతున్నానండి. I want everyone, please put your hands together for the Honorable Deputy CM as he joins me here onto this stage.
Representatives of Times Network, fine. Respected, distinguished doctors and hospital leaders, heads of medical colleges, universities, nursing institutions, innovators from biotechnology, medical devices, telemedicine, and digital health, researchers, public health experts, industry leaders, friends from the media, and all participants gathered here from this morning. It is a privilege to join you at the India Health Summit 2026 South Edition. A summit like this is not only a conference, it is a mirror. It shows us what we have achieved and what we have ignored, and what we must now build with urgency. Let me begin with a simple thought. Health is the most intimate form of governance. A delayed road creates inconvenience. A failed power supply creates anger. A delayed file creates frustration. But when healthcare fails, a family can be broken. A life can be permanently changed. A poor family can lose the savings of a generation. That is why health cannot be treated as one department among many. It is the first security of a citizen, the first infrastructure of development, and the first guarantee of dignity. Health is not only about hospitals, it is about safe childbirth, child nutrition, vaccination, early diagnosis, affordable medicines, timely referral, and whether a poor patient can enter a hospital without fear of the bill. Southern India has shown that public health is not a matter of luck. It is a result of literacy, women's education, nutrition, primary care, medical education, science, institution, administrative seriousness. The South has strong public hospitals and world-class private hospitals. Also, medical colleges and nursing talent, pharma, biotechnology, diagnostics, health tech startups, and research institutions. But leadership is not a certificate, leadership is a duty. If the South has better capacity, then the South must show India how healthcare can become more affordable, more preventive, more ethical, more data-driven, and more human. For us, in the Congress tradition, this is not a new idea. The Congress view of health has always been that science must serve the common citizen, technology must serve the poor, and institutions must serve justice. Pandit Jawaharlal Nehru ji gave India the courage to build scientific institutions when the country was still poor. In that spirit came institutions like All India Institute of Medical Sciences and a national belief that medical excellence must be part of development. The message was clear: a poor country must not have poor ambitions. Indira Gandhi's era deepened the understanding that health begins before the hospital. Nutrition, child development, and maternal care entered the mainstream of public action. ICDS, launched in 1975, rested on a profound truth. If a child is malnourished in the first years of life, no later policy can fully repay that injustice. Sri Rajiv Gandhiji brought the confidence that technology could travel to ordinary people. The universal immunization program gathered momentum in the time. That was not just a vaccine program, it was science traveling to the villages, to the basti, to the last chain. Under Dr. Manmohan Singh ji and the UPA government, the National Rural Health Mission took this forward. The Asha worker became one of the most important bridges between government and the family. This is the legacy we inherit. Institutions from Nehru, child development from Indira Gandhi, technology and immunization from Rajiv Gandhi, and community-based health from the UPA government. We do not invoke this legacy for nostalgia. We invoke it as responsibility. Telangana is carrying that responsibility forward in our own context. Our approach is clear. Good healthcare should not depend on whether a citizen lives in Hyderabad, has a high income, or knows the right person. The test of a healthcare system is how to treat the poor patient who walks in silently with fear in his heart and a file of reports in his hand. That is why we have strengthened Rajiv Arogyasri. The coverage has been enhanced from rupees 5 lakh to 10 lakh. Package rates have been improved. Additional treatments have been brought under coverage. This is not a technical adjustment. It is a message to poor families. Illness should not push you into debt. Treatment should not force you to sell land, jewelry, or dignity. But a health card alone is not health care. The card must be backed by functioning